started, and here is your question. All right, so if you have read and understood, considering the history taking station, kindly begin.
Yes.
Hello, I am Dr. Varki, one of the surgical doctors here. May I confirm your name and age, please?
I'm Dafur, 9 of September 1976.
Nice to meet you, Mr. Dafar.
Me too.
Today, I've been asked to ask a few questions regarding your condition. Are you okay with this?
Yes, with my pleasure, yeah.
How may I help you today?
Actually, I have abdominal pain.
Oh, I'm sorry to hear that. Do you have any other problem as well?
Yes, I feel the abdominal pain, and I sometimes pass blood stain with my poo.
Oh, I'm sorry to hear that. Okay, when did you notice this first?
I saw it about 2 days ago.
2 days.
Sorry, for 6 months. For 6 months, yeah.
Oh, I see. So, did it start suddenly, or it was an insidious, gradually? It started.
Actually, it has become more and more.
Oh, is it progressing day by day?
Yeah.
Like, is it increasing day by day?
Yeah.
Okay. So, have you noticed anything that worsens your condition, that worsens your abdominal pain or the bleeding? Anything like a diet or anything associated with that?
No, it's not. It just came and go. I don't know about what is the
Is there
aggravated.
anything? Oh, I understand. I'm sorry.
Yeah.
Is there anything you feel that decreases the abdominal pain, your tummy pain, or the bleeding?
No, nothing that I'll do to increase or decrease. Yeah, it's just come and go. Yeah.
Okay. So you said you're passing blood through your or outlet. So what's the color of the blood? Is it back passage? So what's the color of the blood? Is it bright red or is it dark colored?
It's bright. Sometimes it is bright. Sometimes it is dark. Sometimes associated with clothes.
Okay, so if you you do you have any associated problem with that? Do you have any pain while passing the blood?
No, actually, it is painless.
Painless. Okay, so if you can quantify the amount of blood you are passing, like is it early streaks or just a teaspoon or a cup? If you can roughly quantify that, that will be more helpful.
It started a few months and then it's a gradual increase. It's mixing with all my poo.
Oh, I see. So I haven't noticed anything else other than the blood, like any slimy material or no, nothing.
No,
so do you have any joint pain or back pain or any skin changes? Any eye reddish discoloration of your eyes? Nothing
no,
like
it's
that.
not.
Have you noticed any recent decrease in your body weight?
Yes, I lost about 10 pounds. Yeah, in last week.
And how's your appetite recently? Okay. So how is your appetite? Have you noticed any change in your appetite?
Yes, it's decreased. I dislike the food.
Have you noticed any recent change in your bowel habits? Like, do you have any loose stools or any constipation?
Yeah, and I'm constipated for last 2 days.
I'm sorry. Can you please repeat?
I'm constipated for last 2 days.
Oh, I'm sorry to hear that. Okay. So, a few more questions. Do you have any bleeding from any other sites, like your mouth or nose or anywhere else?
No, just from my mouth. Yeah, and from my back passage. Okay.
Have you noticed any itching or any swelling in your back passage?
No. I've read, doctor. Is it cancer?
We can't say that right now. Anyway, we need to discuss that with the consultant, and after that only we can know.
Okay.
I will. Okay. So, what is it which is more concerning you about?
Yes, this is my concern. I feel I have a cancer.
Oh, I understand. So, what do you hope from us to do for you?
Actually, I feel from that. I feel you do some investigation for some test for me, or I maybe take some picture or something like that
Sure.
for me.
Don't worry, we will definitely help you out. Can you please answer me a few more questions?
Yes, with my pleasure.
Can you present your
Do you have 64-year-old gentleman presented with bleeding per rectum for the past 6 months, which is gradually progressive and insidious in onset. The patient is passing fresh colored blood and along with clothes, and there is no associated pain. There is associated loss of weight as well as loss of appetite, and there is recent change in his bowel habits like constipation. There is no history of passage of mucus or any extra-intestinal manifestations of inflammatory bowel disease. There is no history of bleeding from other sites to suggest a history of a bleeding disorder. There is no history of mass or any itching around the anal orifice suggestive of local causes like hemorrhoids or
So what are
fissures.
your differential diagnosis?
So considering based on, and his major concern is whether he is having cancer. Based on this, my first differential will be a carcinoma of the colon. My differential diagnosis include inflammatory bowel disease.
Yes.
Then local causes like hemorrhoids.
Okay, what are the most important investigations that you'll carry out to confirm your diagnosis?
Carcinoma is my first diagnosis. I would like to go for a colonoscopy without a biopsy. And I would also like to do blood investigations, including full blood count and bleeding profile, coagulation profile, platelet count, and also do a blood grouping and cross matching. Also biochemical values like urea and electrolytes and liver function test. And other investigations like OGD-scopy, proctoscopy and sigmoidoscopy. Then also I would like to do abdominal X-ray and also CT scan.
Stool microbiology.
And stool microbiology.
That is also very important. Okay, good. Right. If one bell has gone, but if time would have allowed you, what you would have done? How would you have completed your history?
Yeah, I had to ask about past history, about other medical conditions, and I also like to ask about family history, then about any other information I need to know.
Past surgical history, drug history, social
drug
history,
yeah.
and then
Traveling
family
history.
Yeah.
and then systemic review.
Yeah.
You would have done.
System review, yes, ma'am.
Yeah.
Yeah.
And when you were asking, like when the patient told you that patient has abdominal pain, then you could have even asked if to scale the pain between 0 to 10 that you
Yeah.
haven't
Yes.
done as well.
Actually, I
So-
didn't go ask anything about the pain.
No, not at all. That's what I'm
Yeah,
trying to point
yeah.
out. Because you,
Hmm.
discussed everything about the half of the presenting complaint about the stool, but then you
Yes,
forgot
yes.
the pain.
Yes.
You did confirm bowel change, bowel change. Yes, patient told you about the constipation. Patient told about the weight loss and appetite, and then okay, other medical conditions were given here, and the smoker and hypertensive, but then you didn't ask
Yes.
if any medication patient was taking, if patient has undergone any surgeries or yeah. So yes, with practice, we'll make sure that we complete it on time.
Yes, ma'am.
Good, thank you. Okay, started your timer and here is your question. Right, so if you have read and understood, considering it surgical pathology patient, what are your differentials that you'll consider?
Yes, ma'am.
Diagnosis?
Yes, ma'am. Differential diagnosis includes a malignant melanoma.
Good.
It can also be a squamous cell, because it can be the dysplastic nevus.
Okay.
A squamous cell carcinoma.
All right.
Or a basal cell carcinoma.
Can you tell me, can you define what is melanoma?
A melanoma is a malignant neoplasm of the epithelial melanocytes.
Yes.
Mainly arising in the skin.
Yes.
But sometimes it may arise in other parts of the body, including the nasal mucosa, sometimes in the retina, and sometimes in other parts of the brain or GI mucosa.
Good. Can you please tell me 5 differences which differentiates melanoma from squamous cell carcinoma?
Yes, ma'am. A squamous cell carcinoma usually appears as an ulcerated lump, reddish bump or lump or patch, while a melanoma is usually a dark, irregular, poorly defined lesion.
Okay.
Usually, a squamous cell carcinoma is usually is an open sore that bleeds easily, while a melanoma may occur in a previous nevus, which is noticed to have progressively increased in size. There's associated history of previous, in a squamous cell carcinoma, they may have associated previous risk factors, including illness, pre-malignant lesions, including actinic keratosis and xeroderma pigmentosum, while for melanoma, it's usually seen in other
Thank you.
conditions.
Can you please tell me how should an ideal biopsy be taken for if you suspect melanoma or malignant melanoma?
Yes, ma'am. Ideally, it should be an excisional biopsy that should be done when one is suspecting a melanoma, and then depending on this depends on the size of the lesion. If
okay.
it is,
can you please, ma'am, tell me what is Breslow thickness?
Yes, ma'am. Breast lobe thickness is one of the measure. It's a method of measuring the depth of
Very good.
melanoma from
Very good.
pathology. Yes, ma'am.
Can you
Yes, ma'am.
classify, yes, according to breast lobe thickness, how should the melanoma be excised?
Yes, ma'am. If the melanoma is less than 1 millimeter,
Yes.
one will take a margin of 1 centimeter.
Very good. Okay.
Yes, ma'am.
Can you please mention some genes which are responsible for familial malignant melanoma?
Yes, ma'am. It includes the CDK4 gene, the BRCA2 gene, the CDKN2A gene.
Very good. Okay, can you mention few poor prognostic factors when it comes to malignant melanoma?
Yes, ma'am. If the melanoma is ulcerated, if it is located in the lower limbs or the upper limb, or head and neck melanomas, then if it occurs in elderly patients, and then specific histological types like nodular melanoma and the acral lentiginous type of melanoma.
Yes, and in the male gender as well. What are the risk factors that you should keep in your mind when it comes to malignant melanoma?
Yes, ma'am. Individuals who have a past history of melanoma.
Very good.
Immunocompromised patients.
Very good.
Individuals with Hutchinson's freckles. Yes, ma'am. Exposure areas that are exposed to sunlight.
Can you mention few types of malignant melanoma?
Yes, ma'am. We have the superficial spreading type.
Yes.
The lentigo maligna.
Yes.
The acral lentiginous, and the nodular type.
Can you describe desmoplastic type?
Yes, ma'am. It's the type of melanoma that contains the epithelial cells.
No, it's rare non-pigmented lesions or on sun-exposed areas. Okay. Can you please tell me what is epitheloid melanoma?
Yes, ma'am. It's the type of melanoma that contains epithelioid cells, usually which are usually macrophages, which have assumed with macrophages, which specialized macrophages would have undergone changes, and also presence of lymphocytes and I think giant cells. Spindle cells, yes, ma'am.
Okay. What should be the management or treatment that you can offer to this patient? Or
yes,
to
ma'am.
The patient? Yeah.
Yes, ma'am. Following, so I would like to carry out a surgical excision and then possible lymph nodes, groin lymph nodes dissection, and then possible. Usually, chemotherapy can also be done for this patient, especially in advanced stages. And then one may also offer interferon or melphalan chemotherapy to the patients. And then if I'm sorry, one will want to do most micrographic surgery, and then to assess if also all frozen section on table to ensure clear margins intraoperatively.
How would you differentiate between the histology and the cytology of the malignant melanoma?
Yes, ma'am. The histology contains there is presence of tissue. It takes tissue while for cytology, individual cells are seen. So presence of dark pigmented cells, which are with nuclear cytoplasmic ratio and chromatin.
What is the common stain which is used when you are taking the histological section?
Okay. I think it's the S100 stain. I'm not sure. Ma'am.
Can you describe the lesion that you're looking at?
Okay. Usually they appear as okay. This is a dark. It's a dark raised lesion on the skin, which is surrounded by other dark lesions appears to be surrounded by nevi, multiple nevi. This appears to be a dark patch which is raised and on the skin. I think it's a melanoma.
Yeah. Okay. All right. Can you please tell me the skin changes that you could see? You told me, right. I don't
Okay.
know if you
It's
have
a
told
dark
me.
patch with
What is
irregular edge.
xeroderma pigmentation, if you can tell me?
Yes, ma'am.
Xeroderma
Xeroderma pigmentosum is a autosomal dominant condition
Yes.
that is seen in certain individuals
Yes.
and it is as a result of failure of DNA repair genes, which as results in formation of pyrimidine dimers, dimerization, and failure of, and this is actually a risk of development of skin cancers as a result of exposure to UV, following exposure to ultraviolet radiation.
Very good. Okay, Bella's gone. Very good. Excellent. It was the first time you presented and it was very good.
Thank you, ma'am.
All right. Started the timer and here is your question. Right. So if you have read and understood, considering the communication skills station, kindly begin.
Okay. Hi. Good evening, ma'am.
Good evening, sir. Oh, ma'am. Yeah, sorry.
I am Dr. Ajayi Abbas. The ST1 in Dr. Man's team. I've been told that you've been looking for the doctor on call. May I know who I'm speaking with, ma'am? Your name, ma'am? Hello?
So me, okay.
Yes.
I'm Sarah. I'm Tom's mother.
Okay. Oh, okay, ma'am. Oh, okay. You're John's mom. All right, ma'am. So I've been told you wanted to see me. Ma'am, John was brought to our hospital today, following a fall while he was playing in the swing in school by his dad. And we have seen him and we've been able to investigate him. We've asked a few questions, we've examined him, we've taken some bloods for investigation, and then we've also put a scan. We've done an abdominal ultrasound scan, which is a jelly-like examination, an investigation where you put some jelly on the abdomen, and then you examine you on the tummy, and then you check for the organs in the tummy. So, ma'am, we've done that, and then we found out that there's something, an organ in in John's tummy that appears to have been injured, and then which is an emergency, and then we've taken him to the OR for surgery. We've already explained all this to his dad, and then he is given permission for us to carry out surgery on John. Ma'am, do you have any questions at this point?
I need to ask why you didn't wait me to before admit my child for operation, and the other what he had.
Oh, I'm so sorry, ma'am. Your son has an emergency. What's happened to your son is an emergency, and he needed immediate treatment because we can't, for this kind of conditions, we won't be able to wait. And moreover, his dad had we've already seen his dad, and he has already given us consent to go ahead. And aside that, your son is an emergency, and then we have already taken him to theater. Unfortunately, we are so sorry we couldn't wait for you, but because it was an emergency, that's why we couldn't wait. So sorry about that.
Is it serious?
Yes, it is. It's very serious. It's something that if we don't act fast, we could, John could bleed into his tummy, and then this bleeding may result in us losing John, and we don't want that to happen. This is why we acted as fast as we could, ma'am.
What did his father told you?
Yes, he told us, John's father told us that he fell on the swing while he was playing at school. That was why we brought him. That was what happened, and he told us that he brought him to the hospital.
Okay. So, how long did it take time to finish this operation?
Oh yes, ma'am. Hopefully we won't be staying long. At the moment, I'm not with them in the theater. I really can't say how long it will stay, but hopefully we will not be staying for too long at the theater. As far as the surgery is not a complicated one, we're hopeful that very soon John will be out of theater and you can see him.
So, if there is any medication after operation?
Yes, yes, John will be on some IVs and medications, and then yes, he may be initially admitted for close monitoring, and then he'll be given some drugs just to help with the pain and then prevent infections, and then yes, and then after which he'll be placed on some vaccinations, drugs which he would need to be vaccinated for some organisms. We call them post-splenectomy infections, and then he'll get some vaccines, and then he'll be having some others monthly, and then others that would help protect him from infections subsequently. Yes, John will be getting some medications.
So when can I take him to home?
Okay, ma'am. For now, I can't really say when exactly, because that will depend on his condition in the immediate post-operative period. But hopefully, as soon as he's well, and you should be able to go home with John.
Okay.
Okay. So, do you have any further questions for me?
No, thank you.
Is the consultant expert?
Ma'am?
Is the consultant expert in the surgery?
Oh, yes. Mr. Mann is the best surgeon we have at this point in time. He's quite good at what he does. You shouldn't be worried. He will be fine. I also should tell you that the spleen is one of the organs in the body that helps to prevent infections. It fights infections. It also helps in storage of blood and a few other things. So, but then it can be safely removed without any problem. It may depends on what is found inside the operation. They may decide to remove the spleen or maybe just repair it. Also depends on the condition that John is in the theater. Yes, ma'am.
Okay, now discuss about the child issue, the child protection services and all that.
Yes, ma'am. Yes, I know you're worried that your husband is was drunk when he came to the hospital. But I would like to tell you that ma'am, how is the home front? I hope John is safe at home. Is there any problem? If there's any problem, we will involve the child protection services and the social workers. And then I would also inform Dr. Mann about this and the child protection consultants who will discuss with you about the condition at home. And thank you. I would like to confirm that I would like to discuss with you that I would like to discuss with you that I've discussed the case of your child with you, who is a 10-year-old boy who came to the accident and emergency following a fall while playing on a swing. And then we have reviewed him and we found out that he has a splenic injury in his tummy, and then we've taken him to the theater, and I've explained his condition to you and also giving you the option of discussing with child protection services about his father's drunken state when he brought him. following this, we will be discharging John. After they will probably discharge him to the GP to follow him up afterwards. I hope you understood everything I've said, ma'am. Hello.
Just 9
Hello.
seconds.
Yeah.
left.
Okay, thank you very much. Do you have any questions for me?
No, thank you.
All right then. Thank you very much.
Right,
Okay.
good. First of all, you began very well. It was very good. In the middle, when you were explaining, you used the word term drugs. Can you please use the term instead medications instead of
Yes,
drug?
ma'am.
And then you use the term organisms. Instead of using
Oh.
organisms, you can say infections. Simple, or make it even more simple. Rest everything you mentioned, it was good. Everything else was good. I don't think there was any need. If you would have had a proper trained actor sitting next to you, then you would have had a real good conversation. At the end, maybe you can add just one sentence that, okay, you asked if you have any questions, and mother of the child said no. But then you can just at the end say that, okay, I'll be leaving my number with the nursing staff. If there is anything that you want to ask later on or come up in your mind, then you can contact me. Then you can contact, or you can take the number from the nurse.
Yes, ma'am.
So that.
Can I
Yes,
say
ma'am.
something?
Yes, please. Yes, please.
Yes, it is a nice presentation.
Yes.
You read the script very well, but I need to say many points, 3 or 4 points in this station. The communication station, like that, patient with the doctor, it is the mark dividing by the 4 for acknowledged, and 4 for professional, and 12 for communication. So you give more information than what we need. We make me lose my question, because you answer, because if I give one question, you answer about 3 questions for me. So for what I will say, that make the examiner and the other person in this station, there are 2 persons for two examiner. One doctor and the other, it's not. The doctor looking for the knowledge and the professional, and it is 8 mark, and the other looking for the communication. It is 12 mark. Don't forget that. 12 mark. You should give small sentence and active listening, and check every time. Check he understands. He is with you. What he's thinking. Feel what he's thinking. What he's concerned. So to be more accurate, it is give some point to other person to ask the question, not to answer the question before. I'm very happy to see you for the first time speaking in such way. It is very nice.
He's
but we need to more.
He's intelligent. He's doing really well. I'm happy.
Yeah.
Good. Started your timer, and here is your question. Right. So if you've read and understood, considering the communication skills station, can we begin?
I'm Dr. Worky. May I know your name, please?
Hey, hi, I'm Smith.
Hi, Smith. Today I told you to leave the hospital. Can I ask you?
Oh, yes, Dr. Smith. Dr. Verkil, I'm actually very tired. This hospital is boring. I just want to go home. I don't know if you can allow me go home. I'm very tired of this hospital environment.
I understand that, Mr. Smith. I understand that hospitals can be frustrating and disappointing. You should know that people are kept in hospitals only when it's absolutely necessary.
Okay.
Firstly, let me explain about your condition to you. You have something what we call a splenic hematoma. That means there is blood around your spleen, and spleen is an organ. It is an organ inside your tummy, which is located upper left corner. And this occurred because you have a fractured rib around that organ. And you should also know that when I checked the reports, your blood has decreased by 2 units. That means there's a possibility for an ongoing bleed inside your tummy, and which can cause serious deterioration of your condition, or which can even pose a danger to your life. Do you understand that?
Yes, I understand, but doctor, also, my wife, she has breast cancer, and then she's alone. There's nobody to look after her. I need to look after my wife, please. I just
Sorry
need
to
you to
hear
let me
that.
go home.
I definitely understand your condition, but you have to look out for your own health. If you become ill, you should understand that there will be nobody else to take care of her, and her condition will be worse. So, if you're okay, I can talk with the social service team and arrange for some help for her. In the meantime, you get well and discharged from the hospital.
Okay, doctor. Also, I have an interview. My wife is sick. I need to buy her flowers and some gifts, just to make her happy. So I have an interview, and I don't have an active job at the moment. So I have a job interview to attend. So can you just let me go home? Let me attend my job interview, please?
I totally understand your condition, Mr. Smith, but I would suggest that you please reconsider your decision, because your health has to be taken care of. If you are once healthy, then you can look for another job.
Okay, but I have a job interview. I don't know how I'm going to take care of my wife and family. Okay.
Okay, Mr. Smith. Can you please repeat for me what I have told you, so that I may be able to understand that you have comprehended me correctly?
Okay. Yes, you've told me that my condition. I have something in my stomach, that my tummy that is injured, and there's blood, and also the level of my blood has come down. But you would prefer I stay in the hospital. I understand that, but I've also told you that my wife is sick, and then I also have a job interview I would like to attend.
Mr. Smith, as I can't discharge you medically, you have to sign a legal document stating your exact medical conditions, that you have been advised to stay at hospital, and the consequences of the complications that can occur has been explained to you, and you are taking up all the risks. Are you okay with this?
Yes, no problem. I'll sign the forms.
Okay, if you feel that your condition is getting worse, like you are feeling drowsy, or you feel that there is an unbearable tummy pain, then I would suggest that you should attend our emergency department and ask them to directly contact me or the SHO in charge.
Okay, no problem. No problem, doctor.
Mr. Smith, since you have decided to sign the decided to self-discharge and sign the appropriate documents, let me sum up to you what we have been through. You have a condition called splenic hematoma. and there's a possibility you have decided to self-discharge, and there's a possibility that there can be an ongoing bleed, and there is a chance for you becoming more unwell, or your life is even at risk, and you take up the responsibilities, and you have decided to self-discharge. I also informed you that what all signs you have to look for when you are at home, and to contact the emergency services once you feel that you are getting unwell.
Oh, that's okay, no
so
problem.
if you have any more questions, you can just ask me.
Okay, that's no problem. No problem. So I just want to know, what are the things I should be looking for when what are the signs? What will I feel in my body to know that there's a problem?
Okay, Mr. Smith, just as I said earlier, you have to, if you feel that you're feeling drowsy, or if you're feeling that you are losing your energy, you can't stand up, you are feeling weak, you are sweating, or if you feel that you are having unbearable tummy pain, then these are the things that you have to look out for. These are indications that there is a possibility that the bleeding is increasing. So that's the time when you have to suddenly approach the hospital.
All right. Thank you. Thank you. Thank you, doctor.
And you can say your leaving number with the nursing staff.
So I'm leaving my number with the nursing staff. So if you have any more questions, you can just ask her to contact me.
That's okay, doctor. Thank you, doctor.
Yes.
Thank you. Take care.
You still had 1 minute, but all right, good. It was good conversation. You covered all the points. That's why I'm letting you wind up. Otherwise, you still had 1 minute. Right. Here, I want you to consider or be focused on one word that you used twice or thrice. It was, I understand your condition, not your condition. I understand your situation. Condition is medical condition, but situation is his socioeconomic situation, because of which patient is willing to or insisting on leaving or going home. So that's the situation, not the condition. Otherwise,
that's a good point, ma'am. Thank you.
Yeah, it's just the English terminology, English. Yeah. And then you can focus more on, you can say you have to prioritize yourself. You can learn 2 or 3 more sentences in convincing patient to prioritize himself over other issues. So that you can add, and you can say that if you'll be healthy, you have to prioritize yourself. If you'll be healthy, then you'll be able to be there and look after your wife. So you have to consider yourself first. So 2-3 sentences here. Okay, now bell went. Good. So otherwise, everything is good. You did explain, and then he didn't understood, and he did ask you to repeat what are the signs he has to look out for. And yeah, that's it. And at the end, patient will do the complaint as well, because he was a very soft patient, but in exam, patient is very aggressive, and he will do the complaint as well.